Good afternoon. This is the second week since I issued the Safer at Home order, and I'm pleased to announce the cases reported today continue to remain low. There are only 3 new cases, making Hawaii one of the safest states in the nation in the fight against COVID-19. Please keep up the great work, Hawaii. All of your sacrifice is paying off, which will allow us to continue to safely reopen Hawaii's economy. On Friday, many retail stores and shopping malls on Oahu can reopen under the new Safer at Home order, joining retailers and malls that have already opened on the neighbor islands. We encourage you to shop at the newly opened stores and malls, but please remain vigilant. Please follow the social distancing requirements at the malls and stores. You cannot congregate or gather in large groups, and please wear your face masks. And remember that the malls are not a place to loiter. Please make your purchases and head home, where it is safer. In addition to the low number of cases, Hawaii has achieved some other key metrics which are allowing us to reopen our economy. One important factor is adequate capacity in our hospitals to handle a potential surge. With me today is Lieutenant Governor Josh Green, who will provide an update on our healthcare capacity. Another key factor is robust testing and contact tracing. The State Department of Health has been working on a plan to expand our testing and rapidly surge up on our contact tracing. As we continue to reopen businesses, this will be a necessary and important factor to detect and respond to any increase in new cases. With us today is Dr. Bruce Anderson, who will provide the Department of Health's daily update. He will also discuss details of the state's plans for testing and contact tracing. An important part of the contact tracing plan is ensuring adequate numbers of people who are well trained. Dr. Anderson has put together a partnership with the University of Hawaii for a program that will train 300 more contact tracers who can be mobilized in case of a surge. This is in addition to the more than 80 contact tracers already available to the Department of Health. With us today is UH President David Lassner with an update on the university's role in the contact tracing program. I also want to thank our congressional delegation for their efforts in securing $50 million in federal money to pay for contact tracing. They have been working tirelessly to help the people of Hawaii in the fight against this pandemic. And this grant will go a long way in covering the cost of training and responding to a future surge. You're doing great, Hawaii. We are one of the nation's leaders in flattening the curve and getting COVID-19 under control. Keep up the good work. Your friends, family, and neighbors are counting on you to stay the course in our battle against COVID-19. So please take care of yourself, take care of each other, and most importantly, take care of our community.
Thank you, Governor. Our next speaker, Lieutenant Governor Josh Green.
Thank you, Gov. Aloha, everyone. Pleased to be with you today. Just to start with a few updates, as the governor mentioned, and end the program with an idea I hope people will just begin to consider as we work through important ideas to keep Hawaii safe. First of all, as of today, as Gov pointed out, just 3 new cases today. This is consistent with what we've been seeing for the last several weeks, just a small handful of cases. So excellent news there. And to have numbers like that is really just a testament to how hard you've worked and the sacrifice you've made. We also often get asked how many tests we've done, and here is that number. As this morning, best number we have is 37,436 tests have been done. 638 have been positive, as you know, which is 1.7%. It's a very low rate of testing positive because we've had a broad testing program, which is helping us in other ways, as the governor pointed out. So we've reflected on that, and one thing that's important people note is that the Harvard Global Institute, Health Institute, and NPR, they did a state-by-state simulation and did announce that Hawaii was one of just 9 states that have exceeded the testing minimums for reopening. And that's, of course, very important, as the governor mentioned, that we meet these standards so that we can open safely. So these analytics are very important. Another question people have been asking us from a health perspective is, with a large number of positive cases out there in the states across the country, do we have that same problem? And do we have a lot of individuals that we didn't test or we didn't find out that were positive? People have wondered about that. Well, for one, we've shared with you that we would see that in other ways than just a raw count. We would see a surge in our intensive care unit population, number of people who died, number of people on ventilators. But Department of Health has been able to work with other groups to get some extra studies done and to get antibody testing in some areas. For instance, one of our hospital systems did a wide sample, a broad sample of their healthcare workforce. So they tested 2,640 individuals. This was Hawaii Pacific Health. They actually shared it in their literature the other day, and had only 12 people test positive, which was 0.45%, 0.45%. So what that tells you is 1 out of 200 individuals that were tested had antibodies that developed, a very small number. We would expect by clear extrapolation then, there would be even fewer people that would test positive if they weren't working in healthcare, because they have less risk of exposure. And I think that that's very important, because a lot of people have worried, do we have 10 or 15% of our population that had the disease and we never knew? Well, that is not the case. Finally, a couple other talking points I wanted to share with you. We do anticipate more serologic testing in the coming weeks, but we don't know for sure that that is the best test yet. So Department of Health is constantly working on finding what's best for us. Relating deaths, however, we have had 17, as you know. They were related to COVID-19. That continues to make us the lowest mortality rate per capita in the United States, even tied with some other very rural states like Wyoming, where they only have half our population. So we've had the lowest mortality rate, and we've only had 1 fatality in the last, actually it's been 10 days since we've had a fatality. So people are doing really great in the healthcare system, and we did note that phenomenal story of the young man who, after being in a coma for some time, came out and survived. A couple of other quick numbers before I wrap up. This is the number that we traditionally give. Our ICU beds are 43% occupied. Our hospital beds are 54% occupied. That's very low for this time of year, because we're not doing elective procedures, obviously. And our ventilator rate was at 12% utilization, which means we continue to have a great deal of capacity if, God forbid, we see a surge and our kupuna or anyone needs a ventilator. So these were the key things I wanted to share. And then just one additional comment about an idea that we're discussing, and I want people's input about this over time. As you know, sooner or later, the governor will feel we're ready for return of tourism in meaningful ways, but we want to do it safely, as he shared with you. And so you're starting to see some across the globe, some initiatives where people get tested before coming to states, before traveling. I would comment that Iceland, United Arab Emirates have asked for testing before people travel, Guam, so some parts of the world. And I don't know yet, and we will obviously all talk about this, what's the best way to keep risk very minimal. But one thing that we've talked about is a travel with aloha idea. And just to begin to socialize this idea, the concept would be people could get tested before they traveled and then come to us in the spirit of aloha, knowing that they're negative. Hopefully the tests will get easier and easier to do. We were talking just moments before we came out today that in Japan they're talking about a test that only takes 1 minute to test people before they get on a plane. We also noted that Representative Case, Congressman Case, mentioned today that he was seeking some consideration from the federal government to see if people should be tested before traveling to Hawaii. And Senator Schatz announced today a large appropriation, $50 million, that we know is going to be very helpful for us in the state of Hawaii to test, screen. I'll leave that to Director to talk about those, because those are his programs. So the concept is travel with aloha. And I hope you guys will think about it and give me feedback. You know, contact us on social media at LTGov Josh Green if you'd like to weigh in on these kind of things. Because when we do open up to tourism, we want it to be very safe, and we want to welcome travelers, because we're going to go from here, very low rates of COVID, to obviously something higher, and we need to make sure it's safe for our community. So that might be one way that we can do it very safely. So again, I wanted to say thank you for all of your sacrifices. It's been extraordinary to see what you've pulled off and what you've done, and now that the economy is going to begin to be restored, I hope for good times ahead. Aloha.
Thank you very much, Lieutenant Governor. Our next speaker, David Lasner, President, University of Hawaii. Oh, I'm sorry, I'm mistaken. This is Bruce Anderson, Director, Department of Health. Thanks for giving me the signal, Dr. Lasner.
I'd be glad to let Dr. Lasner speak for me anytime. Hello, everyone. Today we have 3 positive cases reported on Oahu. These 3 cases are part of a cluster of cases in one family. One is an adult, the other 2 are children in this family, and we have a total of 7 cases now associated with this extended family situation. The Hawaii Public Housing Authority, the county, and the Community Health Center in the area are providing outreach to this community, and we're of course following up on this. These clusters are going to be issues that are hard to deal with, especially when you have crowding and other issues that have been existing for a long time. But we're making progress, and hopefully we'll be getting this situation in hand very quickly. The total number of cases today in Hawaii is 638. That's the lowest rate of cases per capita in the country. We've been vying with Alaska and Montana as having the lowest numbers of cases, but we certainly have the lowest number of deaths per capita at 17. Since the 14-day mandatory quarantine, I think these numbers are a testament to the community's success in preventing and controlling the spread of the disease, which is only possible because of statewide compliance with social distancing requirements, limited gatherings, cleaning hands, staying home when sick, and other mitigation measures. Testing doesn't prevent the spread of the disease. It's your compliance with these social distancing requirements that really has made the difference. We've also heard a bit about the need for more testing and contact tracing as we move forward to open schools, businesses, and the rest of the economy in return to a new normal. And we're working on expanding that capacity. Today, we're able to easily test for 3,000 tests per day. Our capacity now, or our volume now, is 1,000, and we can surge to test up to 5,000 individuals per day. We're making great progress in that regard. Reopening the state will require that the Department of Health has the ability to identify and quickly investigate new positive cases and contacts. It also requires the readiness of our healthcare system to manage increased cases, enhance surveillance for the disease, and the capacity to screen high-risk groups. So far, our healthcare system has been very able to handle this situation and can surge considerably more than it has been. But we are certainly working on expanding our contact tracing capability. DOH currently has the ability to mobilize employees from various programs for surge support, the public health nursing staff, for example, and as many as 100 staff statewide within the department can be mobilized for imminent disease threats. This includes our existing staff as well as volunteers who have been working with us for some time. The newest development is a training and certification program being established to expand the pool of workers within and outside the Department of Health. This training plan will prepare as many as 200, actually 300 contact tracers, approximately 100 a year, through a partnership with the University of Hawaii. With 300 staff to extend the capacity for monitoring and investigation, we expect to build the capacity up to at least 1,000 cases per day. Hopefully we'll never be near that number. At the maximum time In mid-April, when we saw the maximum number of cases we've seen so far, we were looking at about 30 cases per day. So hopefully we'll be not approaching anything close to that, but we are planning for the worst and are building up our capacity accordingly. In addition, a new digital tool called HealthSpace has already been incorporated to expand monitoring approximately 4 to 5 times over the current capacity. So contact tracers today can probably monitor at least 20 people each day, and that has been a huge boon. By the way, this is far more capacity than we had going into this situation. So I'm very comfortable that we can handle the increased number of cases if they occur. This digital tool was rolled out at the end of April and is expected to be fully implemented by the end of this month. We're one of only a handful of states that is using that tool, but it's proven to be effective everywhere. Through HealthSpace, contacts can provide their health information through a secure online survey, and responses are directly transmitted to the Department of Health. That obviates the need for our staff to be calling 2-3 times a day to get information. It's entered automatically, and we get that information without having to worry about chasing people down. We also have additional plans for enhanced surveillance. Strong surveillance through an enhanced Sentinel surveillance program that monitors for flu-like illness and COVID-19 is one of the foundations of that. This involves a group of private providers around the state who regularly report to us flu-like illness and take samples. We process those samples, and through that means we can keep a handle on what's going on around the state and also know what's happening. We're expanding the private provider network and recruiting staff in the community health centers to allow us to continue that program, and that'll occur indefinitely as we recognize this is not a problem that's going to go away. We're going to need to keep our pulse on what's happening around the state for a long, long time. Currently, there are a total of 32 volunteer healthcare providers reporting from every county, and we're working with 20 community health centers to increase reporting. Our Sentinel surveillance program is just one of a number of programs. We, of course, are monitoring cases, contacts. There's electronic laboratory reporting. We also receive reports from emergency departments. We do require reporting from long-term care facilities and schools, and we look forward to working with the University of Hawaii in developing a testing program that can assure that students returning here are free of COVID-19. And finally, airport surveillance for air travelers is also an important part of our surveillance system. We are working with the CDC quarantine station, the FDA, and DOT on screening at the ports of entry. This program will also be expanded in the near future as we move to reopen travel to Hawaii. Hawaii residents have been amazingly compliant with recommendations, and the results to date, I think, prove they work. The real risk to reopening the state in a timely manner and maintaining the low case numbers and deaths we have over the past few weeks is complacency with social distancing requirements and safer at home requirements and other mitigation measures. It's those measures that have kept us where we are and that will keep us where we are going forward. When we allow more visitors back to Hawaii, we'll certainly cannot rely on past successes to control the spread of COVID-19. We need to be continuing to be vigilant about this. The department is preparing quickly to respond to a second wave of COVID-19 as we all move toward a new normal, which includes the safe opening of businesses and travel here in Hawaii. Thank you.
Thank you very much, Dr. Anderson. And our final speaker is David Lasner, President, University of Hawaii.
Aloha, it's great to be here today, and I'm really pleased to announce a new program that the University of Hawaii has developed in partnership with the State Department of Health. This has been a brainchild of state epidemiologist Dr. Sarah Park and UH's own Dr. Amy Grace, who leads our U Healthy initiative at the UH system. And as noted earlier today, the Department of Health currently has up to about 80 contact tracers, which includes 30 volunteers from the University of Hawaii community. This program will allow us to scale that up to 300 contact tracers. It includes 2 tracks of programs. One would be a 3-day training program for people with a bachelor's degree and some kind of clinical health background. And the other would be a 3-month program, which would take people from a lower level and prepare them to become contact tracers. In addition to those 2 prongs of the program, to directly train contact tracers who would be able to work very efficiently with the new software that's available, part of our partnership with the Department of Health is also set up to train community health workers. So these are people educated generally in our community colleges, and they are specially trained to be sensitive to some of our underrepresented communities who have been most affected by COVID-19, Native Hawaiians, Pacific Islanders, and some of those in rural populations who have not been treated as well by COVID-19 as most of us within the state, given the very low numbers that we've seen. So we believe that these programs to expand the numbers of contact tracers and community health workers will really help protect all of Hawaii's communities. Thank you.
Thank you very much, Dr. Lasner. Now on to our question.